Hello, this time let me talk to you about facial peeling and what is not said about it. To start, there are three main types of chemical peels. 1. Superficial peels. These use mild acids, such as alpha-hydroxy acids, to gently exfoliate the outer layer of the skin. 2. Medium peels. These generally use trichloroacetic acid and penetrate the middle and outer layer of skin cells. 3. Deep peels. The most intensive, often using phenol to penetrate to the lower dermal layer. Each type has its place in treating various skin problems, from fine lines and acne scars to more severe sun damage. Recent studies have shed new light on the potential risks associated with chemical peels. For example, a study published in 2023 in the Journal of Dermatological Science found that certain people with sensitive skin types may experience prolonged redness and irritation even with superficial peels. Additionally, we have found that patients with a history of cold sores are at a higher risk of developing a herpes outbreak after treatment. It is critical that you disclose your complete medical history to your dermatologist before undergoing any peel. For deeper peels, there is an increased risk of hyperpigmentation, especially in patients with darker skin tones. This underscores the importance of tailoring treatments to individual skin types and conditions. Other impressive findings speak about the toxicity and side effects of chemicals used in deep facial peels. Cardiac risks. Phenol, used in deep peels, can damage the heart muscle and cause cardiac arrhythmias. Tachycardia, premature ventricular contractions, paroxysmal atrial tachycardia, and ventricular tachycardia have been reported after phenol peels. In a series of full-face phenol peels, the incidence of cardiac arrhythmias was 6.6%. Cancer risk. There is no specific mention of an increased risk of cancer associated with deep chemical peels in the information provided. Risk of death. Although very rare, there is a potential risk of death due to cardiac and systemic complications from phenol. Phenol is toxic and can cause fatal heart rhythm or nerve damage if not used properly. Other serious risks include kidney and liver damage from systemic absorption of phenol, laryngeal edema that may compromise the airway, toxic shock syndrome in very rare cases. To minimize these risks, it is recommended to perform deep peels only under specialized medical supervision, cardiac monitoring during the procedure, intravenous hydration before and during the procedure. Apply the peel in sections at 15-minute intervals. Limit systemic exposure to phenol. In summary, while deep peels can be effective, they carry significant risks that must be carefully considered and managed by qualified medical professionals. Recommendations prior to treatment. Adequate preparation is essential for the peeling to be a success. Below are some essential steps prior to treatment. Stop using retinoids and exfoliating products at least 1 week before your peel. Avoid sun exposure and tanning beds for at least 2 weeks beforehand. If you are prone to cold sores, start taking an antiviral medication before the procedure. Stay hydrated and follow a gentle skincare routine in the days leading up to your peel. Post-treatment care. After exfoliation, proper care is essential to achieve optimal results and minimize side effects. Keep your skin hydrated with a gentle, fragrance-free moisturizer. Avoid sun exposure and use a broad-spectrum sunscreen SPF 30 or higher daily. Do not pick or peel off the flaking skin. Let it fall off naturally. Avoid strenuous exercise or activities that cause excessive sweating for at least 48 hours. You may experience redness, mild swelling, and peeling of the skin. These are normal reactions. However, if you experience severe pain, excessive swelling, or signs of infection, contact your dermatologist immediately. There are other alternatives. While chemical peels can be very effective, they are not the only option for skin rejuvenation. Below are some less invasive alternatives that have shown promising results. Microdermabrasion. This technique uses fine crystals to gently exfoliate the surface of the skin. Laser treatments. Options like fractional laser resurfacing can address specific skin concerns with minimal recovery time. Intense pulse light, IPL therapy. Effective in addressing pigmentation issues and improving overall skin tone. These alternatives often require multiple sessions to ensure best results, but may be gentler on the skin and have shorter recovery times. Please remember that while facial peels can provide dramatic improvements in skin texture and appearance, they are not without risks. Always consult with a board-certified dermatologist to determine the best treatment plan for your specific skin needs. If you found this information helpful, please subscribe to our channel for more expert skincare tips. Check out our other videos on topics like anti-aging strategies and more. Your journey to healthier, more radiant skin starts here. Thanks for watching, commenting, and sharing this valuable information.